Okay, now what we're gonna do is go over the pain provocation tests that I think are kind of important for you guys to know, and I feel like the book covers them pretty well. The first one is going to be the Gainslings Test. And again, when we talk about pain provocation, we're seeing if they are going to be reporting pain, particularly in their SI joint and or low back, but really we're looking for SI joint stuff. So for the Gainslings test, what you would ask them to do is pull their leg all the way to their chest as high as they can, or you can assist with it. And what you're looking for is pain in the opposite SI or sometimes even in the same side. And it's good to assess both of them to see what's going on. But usually we're looking for pain, bless you.
I'm sorry.
We're looking for pain in either one of the SI joints. Okay, back down, and then you would switch sides. So then let's slide up. And then what we're gonna have is the thigh thrust test. And this one, what we're going to do is we're gonna flex them all the way up, and you're gonna put your hand kind of behind their SI joint, so not like quite on their butt, but then what you're gonna do is you're going to thrust straight backwards, and you can do it once or a couple times. And again, you're assessing to see if they're gonna be reporting pain in their SI joint on the side that you're pushing on. This test is also a good test for PRPPP. Those ladies do not like this test at all. It's one of the best tests that you can use. But anybody who has SI joint problems is also not going to like this test very well. The next one that we have is the distraction test. And when we do this, there's a couple different ways to do it. Some places talk about, and by the way, when you do this, you need to be higher than your person. So I need to use a step stool. Some people talk about it where you can just push straight back and try to push out. So it's a posterior lateral push. And you can do that, but I feel like it's kind of hard to do, especially for people that are bigger than you. So one of the ways that I recommend that you do it is you're gonna crisscross your arms and you're going to push out like you're doing this. So this hand is gonna be pushing towards me. Actually, I should probably move down a little bit so that way I'm not like straight in line with her. So this one's gonna push this way and this one's gonna push this way, and you're pushing your hands away from each other. You also should let your person know that this may not be the most comfortable thing that they have ever experienced in their lifetime, because by the way, the interior side of your anterior iliac crest is a little bit on the tender side. So you're gonna get in there and you're putting the heels of your hands in there, and then you're going to push away. And again, you might bounce it a little bit, but you can hold it for up to 30 seconds. And if they still don't have pain, then you can do a bounce, and notice she just loves it. But where's your pain?
In my iliac crest.
Yeah, it's anterior, it's not posterior. So there's a difference between, are they complaining of SI pain, or is it just because this is really tender? That's very different. So again, it's really important that we ask, where are you experiencing the pain and how much pain are you experiencing when we're doing it? So the next one is a compression test. You can do it when they're lying on their sides and just pushing them together, but it's a little bit better instead to stand up high, have them lay on their side, interlace your fingers, get up on their iliac crest, and then push down. And again, you can hold it for 30 seconds, and you can also bounce a little bit, and you're going to be assessing for pain that is occurring in their SI joint, so on the back side of their body. All right, and then the very last one, you would ask them to lay on their stomach, and you're gonna be doing the sacral thrust. And when we do this, again, we're interlacing our fingers, and you need to tell them that you are going to be touching their backside, so don't surprise them when you do it. So you're gonna be putting your hands on their sacrum, interlace your fingers, find where their sacrum is, and then you're going to give them multiple thrusts straight through the sacrum, so like a posterior to anterior thrust pushing down to see if they complain of pain on their SI joint on either side or both sides. And this is actually another good test to use as we're going through all the various pain provocation tests.